Dear friends, thank you for contributing to the most important discussion about heart health in the world. As we get ready to delve into a new form of our joint congress, I would like to pay a special tribute to those who are in the front lines of what is an unprecedented struggle with a rapidly spreading virus. I refer to all my colleagues who treat patients infected with COVID-19 and those who are fighting its expansion. Now we are all needed by the whole world and all eyes are on us, and I am grateful for everyone's dedication and professionalism. Our thoughts go out to those who have lost their loved ones to the new coronavirus and those colleagues who lost their lives to save others. As the world is in full speed fighting the global pandemic, our co-hosts, the American College of Cardiology and the World Heart Federation, rushed to issue clinical bulletins outlining the cardiac implication of the new virus. We, as the World Heart Federation, the global organization of the cardiovascular community, are committed to sharing the latest evidence and providing advice on the type of measures necessary to save and protect lives, with a specific focus on low-income regions. Let me present you briefly who we are, what we do, and tell you about my research and clinical focus in Africa and why we shouldn't stop pushing for change. The World Heart Federation is the global voice of the heart, uniting scientific, research, medical, civil society and patient groups. For this Congress, we have joined forces with the ACC so we can bring our global perspective to the sessions. We have over 200 cardiovascular societies and foundations, as members are from more than 100 countries. We are the only global cardiovascular organization which speaks for those in low-income settings where the need is greatest. We are advocates for change in policy and behavior to ensure everyone, everywhere has access to care and is empowered to live a healthier and better life. Our activities are aimed at raising awareness of cardiovascular disease, strengthening health systems and addressing inequities, and pushing for policies and practicing to reduce the prevalence of CVD and addressing it in a better way. Cardiovascular disease ends the lives of almost 18 million people every year. WHF is working to reduce those numbers, and we're not doing it alone. We use the expertise of our 200 members to help make cardiovascular disease a top priority on the global agenda. We use our connections with the United Nations to ensure that the Sustainable Development Goals are always on our mind when budgets and policies are approved. And as the only CVD organization in official relationship with the World Health Organization, we advocate directly to decision makers for the policies that will help control and prevent CVD. Together, we are working to reduce the burden of neglected diseases in poor areas, including Chagas disease, a life-threatening illness that affects 7 million people globally. WHF, in collaboration with the Inter-American Society of Cardiology, is launching during the Congress a new Chagas roadmap to help improve the screening, diagnosis and treatment of Chagas cases. WHF is also working to reduce the impact of air pollution on people's health, as well as encouraging ministers of finance to implement fiscal policies such as taxes on tobacco, alcohol, sugar drinks and fossil fuels. Africa is my home and the home of my family. I've worked as a clinical cardiologist here for the past 28 years. I live and breathe the continent's progress and problems. Let me tell you about one of my major thematic areas of research and interest, and one where WHF leads on mobilizing global action. Rheumatic heart disease remains a significant cause for cardiovascular disease in the world today, affecting 33 million people worldwide. RHD has a huge cost to society in poor regions as it affects mainly young people. RHD is a leading cause of premature death and incapacity in Africa, but also China and India. A serious public health problem, RHD has been largely unnoticed by society and policymakers. Our job as a global authority on cardiovascular health is to unite and empower RHD community, including those living with the disease, help countries integrate RHD into their national plans, and support the implementation of the 2018 WHO resolution on rheumatic fever and rheumatic heart disease. What does that mean in practice, and how far are we from our ambition to eliminate RHD in a decade? Let me tell you the story of Rosa Vasco, a 22-year-old mother from Mozambique. Rosa had just given birth to a baby girl when she was starting feeling weak and became short of breath. She was diagnosed with RHD, hospitalized, and is now home on heart failure medication, which allows her to take care of her child, cook, and in general feel better. She is also on secondary RHD penicillin prophylaxis to prevent further valve damage. But every trip to the hospital is hard and costly, and in order to purchase her medication, she and her husband often take loans. Rosa dreams of having another child, owning a house, and having a job. Most probably none of this is going to happen. Rosa needs more than medication. She needs surgery to replace her damaged valve. Our goal is to create more awareness via school programs, improving access to penicillin as a primary and secondary prophylaxis, facilitate access to medication and cardiac surgery for the millions of children and young adults suffering from RHD, so that they never have to face a situation such as Rosa. With RHD, there is also a point of no return when heart surgery is not possible anymore due to severe cardiac dysfunction. Luckily, what we see now is a new determination on a global level to address the unmet needs for life-saving cardiac surgery in low and middle-income countries. A first concrete step is the establishment of local cardiac surgeries that are independent from fly-in missions. I'm happy to share with you that the Cardiac Surgical Inter-Society Alliance, an unprecedented collaborative effort to improve access to cardiac surgery for children and young adults, has already identified and visited the finalists for this ambitious project: Mozambique, Zimbabwe, and Rwanda. Building sustainable centers for life-saving cardiac surgery in developing countries will address a glaring gap in public health, that of caring for RHD patients. Partnerships like this one are crucial to achieving our goals. We must continue pushing for global action to tackle cardiovascular disease risk factors and ensure essential medicine for everyone. Joining our forces, we can move another step closer to reach the United Nations targets. We can design a world where everyone has access to the information, care and treatment they need in order to live longer and healthier lives. A heartfelt thank you to you at ACC for making this virtual experience possible despite the challenging times, to WHF staff and to WHF President-elect Professor Fausto Pinto for his investment and significant contribution planning the sessions before we were hit by the pandemic. Please enjoy the virtual Congress.